Thank you so much. Let's start with a small prayer. Of course, Sir did a prayer. I just wanted to repeat that. Om Sahana Bhavatu Sahanau Bhunaktu Sahaviryam Karavavagai Tejasvinamaditamasthu Mavit Vishavagai. Om Shanti, Shanti, Shanti. Thank you so much for that wonderful introduction, Jarida Madam. I appreciate one and all who are here. Welcome all. Greetings to everyone. Hope everyone is staying safe in their homes in this pandemic situation. I would like to thank Dr. Mangaleshwaran. Just a moment. I would like to thank Dr. Mangaleshwaran, Dr. Nirmala, Dr. Jarida, Dr. Ilango, Dr. Rajavel, and also Dr. Selvamani for all the efforts in organizing this webinar. Just a few words about me. I'm a physiotherapist for the last 25 years. Throughout this journey, my main focus is incorporating traditional wisdom of yoga therapy into our main line of practice, physiotherapy, in the management of our day-to-day problems with the patients. Of course, apart from doing my own clinical manual therapy programs, I also had the opportunity to do my 2 years teacher training from the Pioneer Institute of Yoga, Krishnamacharya Yoga Mandiram, Chennai, India, which gave me an enormous insight into how we can incorporate this holistic knowledge into our regular physiotherapy practice, which proves really very effective and beneficial for the patients. And in the current scenario, as we all know, the novel coronavirus mainly affects the immune system and the respiratory system. Of course, the doctors are baffled at witnessing how this novel virus is affecting other unconnected systems as well, as they are witnessing several symptoms from different organs and different systems, unrelated systems from the respiratory tract. But given the mortality and morbidity rate, it is still the respiratory system that proves more challenging and more vulnerable and poses more challenges. Many deaths, sudden deaths, even nowadays they report like deaths at the middle age as well. Before it was considered that it affects mainly the elderly people, but now there are reports that people belong to middle age and lower middle age also affected, and sometimes they die suddenly. That is the main problem with this coronavirus. It can immediately suddenly progress to a condition where it can kill people. That is the main problem with this novel coronavirus. So with that introduction, we are going to integrate yoga therapy into our physiotherapy practice. So this session is not going to be like a demonstration of yoga or something. It's going to be like some certain life-saving measures that if everyone knows, whether you are a normal person who have no symptoms, or whether you are a COVID-19 survivor, or whether you are someone who is helping or whose family members have any symptoms, or who is someone who is a high-risk people, if you at least know these basic techniques, probably it's going to be a life-saving measure at some point of time, particularly during this pandemic situation. So with that introduction, Yep. Yes, my PPT is viewable now. Are you able to see my
Yes.
PPT?
Yes. Yes, it has come.
Good. Thank you. Yeah, I'm a physiotherapist, clinical yoga therapist, and I'm also a teaching faculty in the Mount Royal University, Calgary, Canada. With that introduction, we will move on to our session. But it's going to be in two parts. Like in the first part, we are going to discuss about the anatomical background and the scientific facts, how yoga and breathing exercises influence the well-being of our respiratory system. On the second part, I will try to demonstrate most of these techniques today, because it's mainly concentrating on the respiratory system. So probably I will be able to demonstrate most of them, unlike tomorrow, which is going to be a little bit more complicated topic and lots to discuss. Anyway, even today, please closely follow me so that you can understand and learn these techniques, which you can practice on your own. So with our diligent research, we have landed on inventing this Pranayama-integrated breathing techniques. In our modern therapies, where we physiotherapists and respiratory therapists, we teach lots of chest expansion techniques, airway clearing techniques, breathing exercises, even in the ICU, intensive care units, and also in cardiopulmonary rehabilitation setup. On the other hand, we have this ancient wisdom, which is traditionally taught by sages and gurus, and now in the modern days, they are taught by the yoga therapists. They include pranayama techniques and kriya techniques. They are also time-tested and getting endorsed by doctors in scientific studies. That is what is really fascinating, that most of our ancient wisdoms are being endorsed by the scientific research now. So even today's session, I have chosen only those techniques which have a very high scientific background. Traditionally, based on the scriptures, there are several other yoga techniques and breathing techniques which would have been really great to know. If you know, or if you have an opportunity to learn, I always advise you to go with that, because it is either the modern science is not enough equipped to test the results of all those ancient wisdom, or it's underway, it's under process, we are doing it. Probably we will be proving the effects and uses of most of these techniques in the time to come. So with this pranayama integrated breathing techniques, we have chosen basically 6 techniques. That includes 3 basic breathing techniques and 3 specific pranayama techniques. The disclaimers. This session is only for educational purposes and not a medical advice. Please do consult your doctor or therapist before starting if you have any specific complaints. COVID-19 has various other associated problems which needs multifactorial approach. These breathing techniques could be one of the most important part of it, but surely not all. In this session, today's session, we are going to cover only the respiratory system. We're not going to see, as sir mentioned, we are not going to discuss about immune system, because that's another huge topic. So even tomorrow, we will be seeing the psychological problems and how we can address that with yoga therapy, but not immune system. So let's start with a brief review of anatomy here, because that will help us understand better the factors behind practicing these pranayama techniques for this particular COVID-19 kind of infection. Because these 6 techniques that we have chosen, they are specifically appropriate and particularly beneficial for COVID-19 related respiratory conditions. So coming to the anatomy, our respiratory system is divided into an upper respiratory tract and a lower respiratory tract. Upper respiratory tract starts from the nose nasal cavity, paranasal sinuses, nasopharynx, oropharynx, and laryngopharynx, ending at larynx, the voice box. Here in this image, you are viewing our upper respiratory tract. You can see it starts from the nasal cavity. That is the nasal passage, nasal cavity. It starts from the nose, nostril, and the nasal cavity. Continues as nasopharynx, oropharynx, laryngopharynx, and ends at the larynx, the voice box. Here, it's important to note the top two paranasal sinuses, because they play an important role in the prevention of any lung infection. We will be discussing about it shortly. Coming to the lower respiratory tract, starting from trachea, with the right and left lungs, if you see, it looks like an inverted tree with its branches, right? So the trachea divides into right and left main bronchus. After entering the lungs, it again divides into secondary bronchi, and the bronchus keeps branching further into smaller and smaller branches, finally ending into terminal bronchiole. They further subdivide into smaller alveolar ducts, and finally they end at the cup-shaped alveoli and the alveolar sacs. You can see how these structures look like a bunch of grapes, with a cap stem. There are around 480 million alveoli present in our lungs. It is at this level the gaseous exchange happens in the lungs. So for the gaseous exchange to happen well, they have to be patent. That means they have to be inflated and open. If they collapse, if they are not inflated, then the gaseous exchange cannot happen because the air cannot enter there. For them to be patent and open, there is one important substance that is useful, is the surfactant. This surfactant is produced by certain kinds of cells.
Please share your screen, sir.
Screen is already shared. You pin the presentation. Mahasri Senthil Kumar's presentation. That is speaker.
You got it?
I think they might be having some problem. You can proceed, sir, because it's visible.
Yeah. I got it, sir. Thank you. Got it. Thank you.
Yeah. Okay.
So this surfactant is one that maintains the air sacs patent and prevents them from collapsing. Particularly these infections like COVID-19 mainly affects those cells in these alveoli that secrete the surfactant. That means it is targeting those cells and kills them, so that there is no more surfactant available to maintain the air sacs patent. So they collapse. So what will happen if they collapse? So this is what happens. In this image, in the first image, you can see how an healthy alveoli looks inflated. In the second image, you can see what happens and how it looks when it collapses. It is shrunken. And when lots of alveoli are shrinking, then this is what happens. Finally, it goes to lung collapse. The entire lung collapses. This doesn't take longer time. If the symptoms and the situation is conducive, it can happen very drastically, like within a day or two. That is how, when particularly with this COVID-19 infection, the progress is very quick. So the patient can be immediately in ICU, who have been totally all right a day ago, will end up like lying on an ICU bed within a day or two. That is the main danger with this COVID-19 infection. So that collapse of lungs is called as atelectasis, which can lead to death. So pathologically, what happens? There is damage to type 2 alveolar cells, which reduces the surfactant production, which leads to alveolar collapse. When huge number of alveoli collapse, it leads to what is called as acute respiratory failure. In this case, they call it as CARS, COVID-19 related acute respiratory failure. Once a patient, a person is in this condition, he needs immediate hospitalization and immediate intubation with ventilator. If there is any delay, he can quickly die. So if he gets immediate medical assistance, the person can recover with chronic complications of this pulmonary fibrosis. So another important thing, the nasal cavity, and we saw the paranasal sinuses. They play an important role for this surfactant production, here. For this surfactant production, what is important is the nitric oxide. This nitric oxide is produced by the nasal, paranasal sinuses that we saw in our anatomy session. Like if you want, you can go back, see here. These two paranasal sinuses, our inhaled air has nitrogen and oxygen, but these paranasal sinuses helps the nasal cavity to change them into nitric oxide, which is important for the production of the surfactant. So this nitric acid has two main functions. One, it helps in production of surfactant. On the other hand, it is also has antimicrobial and antiviral properties. That means it sterilizes the air that enters the lung. So it is important that you always breathe through your nose, at least when you are out among people, so that this nasal cavity to some extent can prevent the infection from entering your lungs. On the other hand, it increases the surfactant production and it prevents an alveolar collapse. So in that way, our nose and the nitric oxide becomes a first line of defense against any infection, not only COVID-19, any infection reaching our lungs. It's really fascinating to see that one of our pranayama techniques, namely Brahmari Pranayama, that is the humming bee breath, which has the quality of stimulating the paranasal sinuses, which in turn increases the nitric oxide release, which will stimulate the alveolar type 2 cells in the alveoli to increase the surfactant production. So we will be seeing about this technique shortly. Coming back to the alveoli and capillaries anatomy. So here you can see how these alveoli are surrounded by a closely knitted small blood vessels called as capillaries. Just a moment. So these capillaries brings used blood, that is deoxygenated blood, from throughout the body. On the other hand, in the alveoli, it contains more oxygen after an inhalation, and it is in this stage where the gaseous exchange happens. That is, the oxygen from the alveoli reaches the blood in the capillary, and the carbon dioxide in the blood in the capillary reaches the gas in the alveoli, which will be eventually exhaled during our next exhalation. So what is important here is your breath has to reach deep into your lungs so that this gaseous exchange can happen effectively. So many times, if you see when you are stressed or when you have breathing difficulty, your breathing will be very shallow. Even normal people, the breathing is very shallow. It's not even deep enough for the gas to reach the alveolar level where there can be better gaseous exchange between the capillary blood and the alveoli. So it is important that you deep breathe. So the first point, it is important that you breathe through your nose. The second one, it's important that you breathe deep so that there can be better gaseous exchange, which can result in better oxygen saturation. So with lungs, the other thing, the efficacy of gaseous exchange depends upon this factor called the ventilation perfusion ratio. That depends upon how much blood comes into close contact with the alveolar gas. So our lung is usually divided into three zones, the upper, middle, and lower zone. So if you see, the distribution of blood in the lungs is gravity dependent. That means the lower zone gets more blood circulation, while obviously the gas is easy to go to the upper zones, So in the upper zone, there will be more air than blood. That results in increased ventilation, but reduced perfusion. In the middle zone, it's a kind of equal. It depends upon the condition of the lungs. And in the lower zone, more blood comes compared to the air. So there you will have decreased ventilation, and increased perfusion. Because of this factor, the doctors advise the patients in the ICU to lie on their tummy, So in the upright position, they consider that there is no enough gaseous exchange happening in the upper zone. So when you lie down on your tummy, you can direct the air, the inhaled air direct to your lower zones of the lungs, so that there can be better gaseous exchange. That is the concept. But it is again fascinating to know that we can achieve this same effect even in an upright position or lying on the back using our pranayama integrated breathing techniques. We'll be seeing those techniques shortly. Next is the lung volumes and capacity. The total amount of air that our lungs can contain is around 6 liters. It is called as total lung capacity, out of which 1 liter always remains in the lung. That is called as residual volume. And that means the rest, around 4.5 to 5 liters, they only can be inhaled and exhaled through deep breath. So that is called as vital capacity. But out of which only 10%, around 500 ml of air that we breathe in and out in our normal breath. As we saw before in the anatomy section, the blood capillaries are present only at the deep lungs, at the alveolar level. It is not present even in the bronchiole. So if only your air reaches the alveoli, then only there can be gaseous exchange. There cannot be any gaseous exchange in between. You have to understand, yoga understood this great scientific factor, that gaseous exchange doesn't happen when you breathe in or breathe out. It happens only between your inhalation and exhalation. That's why yoga concentrates on breath hold. We'll be discussing about it later. So it is also obvious that the gas exchange to happen, the air needs to reach to those deep lung level, that is the alveoli. So what happens, about 150 ml of the tidal volume remains in the air passage where there can be no gaseous exchange happening. That is from the nose till the terminal bronchiole. There can be no gaseous exchange happen. So out of 500 ml, it is only 350 ml is available for gaseous exchange. So the rest of the 150 ml, we call it as dead space volume. Yeah. So the blood capillaries present only at the alveolar. That's what we have seen. So the 150 ml that remains in the passage where there cannot be gaseous exchange is called as dead space volume. So the tidal volume and dead space volume ratio determines the effectiveness of the breathing. So if the ratio is higher, then your breathing is effective. So with our pranayama integrated breathing techniques, we can improve the total, the tidal volume, which will in turn increase the tidal volume, dead space volume ratio, which will in turn improve the ventilation perfusion ratio. That is how we determine that you are getting a better effective breathing. That is achievable through our pranayama integrated breathing techniques. So the last factor here is the neuropsychomusculoskeletal aspects. We have to understand that our diaphragm, which is a main breathing muscle, that is how we consider, but it also has other dimensions, like it has an emotional dimension, it has a postural dimension, it also has a spiritual dimension. So that's why in yoga therapy and traditional yoga, we always concentrate on one muscle, that is diaphragm. We don't care about all the other muscles, whether they are working properly or not. But if this one muscle works properly, then your system, everything will work properly. So impairment. So this, we are going to discuss in detail about the psychological background and psychological management of psychological problems with yoga, integration of yoga in our tomorrow session. So I will probably skip this to tomorrow, this slide. But one thing is the postural problems. So when your diaphragm is weak, you will start using all your other accessory breathing muscles, that is the chest muscles, which will in turn affect your posture. That's how people develop neck pain, back pain, shoulder pain, all these complaints which are associated with their actual lung issue. So with that background, we are now coming to the pranayama integrated breathing techniques. So all these techniques, they have very high scientific foundations. They are getting researched widely in our day-to-day practice. And there are lots of supporting documents. I've chosen only those techniques which have lots of supporting documents as of now. And there are reasons to do them, particularly in this COVID-19 kind of pandemic. So it includes 6 techniques, as I told you, 3 therapeutic breathing techniques and 3 specialized pranayama techniques. The 3 therapeutic breathing techniques are breath awareness, conscious breathing, effective breathing techniques, yogic breathing techniques. And the 3 specialized pranayama techniques are Nadi Shodhana Pranayama, alternate nostril breathing, Bhramari Pranayama, humming deep breath, and Ujjayi breath. Technique number 1, breath awareness or conscious breathing. It's not simply being aware that you are breathing. Everyone knows that we are breathing, otherwise we are not live anymore. So we have to follow the breath top to bottom with awareness. It reveals how healthy your breathing apparatus is. So once you start doing, you will realize how it is calming, relaxing, and it's also very, very psychotherapeutic. It actually balances the autonomic nervous system, resulting in positive effect on several other body systems. That is a technique. Always, whenever you do any pranayama techniques, you can either sit down or lie down, whichever is comfortable, but you have to be in a comfortable position. So you're going to take a normal breath. Do not modify here. We are not going to extend or shorten. We are not going to modify the breath at all. Just let it happen simply. Just close your eyes. That will help you to internalize yourself. You can do that if it's comfortable. Just observe the breath with a silent witness attitude and make a mental note of how you are breathing. Is the breath fast, slow, or shallow, or deep, regular or irregular? Which part of the chest are you using more? Is that thoracic, abdominal? Or are there any discomfort or difficulties in breathing? Slowly start observing the breath at its entry point, the nose. Follow it to back of the mouth, throat, and to the windpipe, the trachea. Going further now, you will feel how the air inflates slowly both the lungs. Observe the expansion and contraction of the lungs with every inhalation and exhalation, basically your chest. Now feel how the diaphragm, which is the lower part of the chest cavity, pushes the abdominal organs down with every inhalation and how it relaxes and recoils with exhalation. Repeat this for 6 times. I'm going to demonstrate this. Okay, I'm going to simply demonstrate this. If you can follow me, because this is one important technique where you can see how healthy your breathing apparatus is. And you can also compare, after doing all of the techniques, you can compare whether there is any improvement or changes in the function of your respiratory tract. So you're going to sit comfortably. Simply sit, close your eyes, you're going to follow. Just if you are alone, sitting in a calm and quiet place, you can watch your breath. You can watch your breath at each and every level of its passage. So you can watch how your breath enters your nose. You can feel the movement of the small hairs in your nose. You can feel how it goes to the nasal passage. You can feel how it enters the nasopharynx and slowly it comes to the throat, and finally it comes down to the lung. As you continue to observe, you can see how the breath, of course, you cannot observe all the steps in one single breath. You have to continue observing. So you can see how the chest slowly expands and deflates with every breath. Here you can notice how shallow or how deep your breath is. Please make a note of it. And also you can observe whether you are either you are using your abdominals more, or if you are using your thoracic area more, or whether you are using your clavicular or upper chest more for your breath. Just have a mental note of what is happening throughout your breath, so that you can see whether you are making any progress with our techniques. Coming to our next technique, which is very important, effective breathing technique. This has two components, and each component has 3 stages or levels. Component number 1 has 3 stages or levels: diaphragmatic breathing, thoracic breathing, and clavicular breathing. Diaphragmatic breathing, you're going to sit in a comfortable position. Place one hand on the abdomen. As you inhale, feel the diaphragm, the lowermost part of the chest cavity moving down, pushing the abdominal content outwards, expanding the lungs downwards. So that is the technique. You're going to sit in a comfortable position. Place one hand on your abdomen. As you inhale, feel the diaphragm, the lowermost part of the chest cavity moving down, pushing the upper abdominal organs outward, expanding the lung downward. Slowly try to prolong your breath until you feel that the lung is fully expanded downwards, and then exhale completely. You must be completely conscious throughout the breath. As you slowly breathe in, try to push the hand up and out, and as you exhale, towards the end of the exhalation, apply a gentle pressure which will assist in a bit more complete clearance before you take your next breath in. We're going to demonstrate that. So that before going to the thoracic breathing, let me demonstrate that. Yeah. So what you're going to do, hope you're able to see my abdomen. So you're going to have one hand in your abdomen. So as you breathe in, you're going to direct your air straight down. You're going to use your abdominal muscles mainly. So when you breathe in, your hand should go up and out. And as you breathe out, your hand should go in. So what I'm going to do, I'm going to breathe in. And as I breathe out, at the end of the exhalation, I can apply a mild pressure. So that will help in improved clearance of the lungs, so that before we take our next breath in. In that way, you can assure that you are clearing your lungs fully, and then also it gives a sensory feedback that you are using your diaphragm properly. Coming to the thoracic breathing, this is more important as far as the COVID-19 related lung conditions are concerned, because we need mainly the thoracic breathing to expand the lungs fully. So you're going to place your hands on the last 2 to 3 ribs on either side. You're going to inhale by slowly expanding the rib cage, and you will feel the movement of the ribs under your hands, outwards, upwards, and forwards, drawing air into the lungs. Expand the chest as much as possible. As you exhale, feel the rib cage relax back to the starting position. Apply gentle pressure with your hands, forcing the air completely out of lungs before starting to take the next breath. Alternatively, you can use a long towel or belt instead of your hands to guide through the breath. Thoracic expansion exercises can be done both sides together or one after the other. So I'm going to demonstrate because that's more important. This thing. Okay. So what we're going to do, we're going to have our hand on either side. We're going to have our hands on either side of the last 2 to 3 ribs. As you breathe in, you're going to feel, of course, it's going to inflate the entire chest. But here, you are going to feel as if you are directing your air in and it goes straight under your hands. Okay. So what I'm going to do, of course, I will be still using my abdominals, but it's important that you see like, and then as you breathe out, as you breathe out, try to give a mild overpressure so that that helps in the improved clearance of the lung fields before you take your next breath in. Let me do once more. I'm breathing in and breathe out. So alternatively, you can use a towel or a long belt. I'm using my manual therapy belt here. So the belt actually runs just above the last 2 to 3 ribs. I'm going to hold like that. And as I breathe in, you can see at the end of the exhalation, I can give a mild pressure so that that actually encourages the lungs to clear better. I can raise the belt higher if I want to expand my other areas of the chest. So that you can decide from your breath observation, our first technique, where you will notice, if you notice that you are using one side of your lungs better than the other, then you can also do this technique unilaterally. But for example, if you think that you are not using your right side chest properly, then you can just try to expand your right side chest. So what we're going to do, we're going to have our hands on the right side. And as I inhale, I'm going to imagine as if I'm going to direct all the air to that side, you know. And I can try to bend to the other side so that the air goes to the right side. I'm going to do like that. So like that, we can direct air to any specific area of our lungs, particularly our thoracic area. It's very important that you have a fully expanding thoracic area. As we saw before, if only your thoracic area expands fully, the air can reach to the alveoli level. That will enhance the gaseous exchange that can happen at the alveoli level. We will discuss about the effect of it shortly. So next is the clavicular breathing. It's best to do this one side after the other. Same thing, you're going to place one hand over and above the collarbone. Start with thoracic breathing. When the ribs are fully expanded, inhale more until expansion is felt in the upper portion of the lungs, just below the collarbones. Try to move your hands up and out with the breath as you inhale. Apply gentle pressure, same thing. Like, you know, like you're just going to have your hand on top of your clavicular bone, that's your collarbone. And it's usually done one side, then the other side. So as you inhale, you're going to expand that side. And as you exhale, you can apply a mild overpressure so that can clear the chest a bit more better. So that's about the clavicular breathing. So with that, we are done with the effective breathing technique component 1. We are now coming to the effective breathing technique component 2. In this component, again, we have 3 levels. In the component 1, we expanded our lungs area-wise. Now, we are going to expand our lungs time-wise. So we'll see one by one. Effective breathing technique, component 2, level 1. You're going to concentrate on your breath. Start numbering the inhalation and exhalation, like inhale 1, 2, 3, 4, and exhale 1, 2, 3, 4. You can keep both components equally numbered and have the exhale longer than the inhale. To start with, we will have both components equal. So the ratio would be 4:4. That means you're going to inhale for 4 counts and exhale for 4 counts. If you're not comfortable with 4, then you can start from 3 or whichever number you are comfortable. You see, if you're a novice, if you're new to do any breathing exercises, you can start with a lesser number. Even 3 is good. If you are already doing some breathing exercises, probably 4 is going to be a bit smaller. If you think, you can go with a higher number like 5 or 6, whatever it is. But you can gradually keep increasing the number as you progress. I'm sorry. So I have to demonstrate that. Just give me a minute. Okay. So what we're going to do here, you're going to breathe in. Don't worry about whether you're going to use your abdominal or your thoracic. Mostly, once you do the component number 1, it's going to be mainly your abdominal and your thoracic levels, which are commonly used. In this component, we are going to concentrate only on the numbers and time, how long you breathe in and how long you breathe out. So what we're going to do, we're going to breathe in, count. So I'm going to breathe in for 4 and breathe out for 4. Simply close your eyes, start breathing in, and then breathe out. Simple 1 cycle. You're going to repeat that for 6 cycles. I have to rush a bit because there are a lot to discuss and a lot of techniques to show. I could show only once. Of course, we are doing free online yoga as well as pranayama sessions at this point of time, particularly during this COVID-19. If any one of you are interested, you are welcome to join for a more guided 1-hour practice of all these pranayama techniques as well as yoga techniques. But for the webinar purpose, my main idea is for you to understand what are all the techniques available and what are all techniques that you can use in a given situation. Coming to the effective breathing technique component 2, level 1, you're going to concentrate on your breath. You're going to start numbering. I'm sorry. You're going to level 2. I'm sorry. In the second level, we introduce breath hold. This is very, very important. So you're going to inhale for 4 counts, hold after inhale for 2 counts, followed by exhale for 4 counts. So hold after exhale for 2 counts, and then the cycle continues. So the ratio will be 4:2:4:2. So we have to. Okay. So what we're going to do, sit in a comfortable position. You're going to inhale, inhale, and you're going to hold for 2, and then exhale for 4. Hold for 2, and then inhale for 4 again. Hold for 2 before you take the next exhalation. So the process continues, the cycle continues. We will discuss about the importance of breath hold shortly. Coming to the component 2, level 3, the third level, the ratio will become 4:2:1:4:2:1. We just added one more component. What you do here is after inhalation for a count of 4 and hold for a count of 2, you're going to take a sniff for a count of 1. Meaning, try to inhale a bit more air in before starting to exhale. Similarly, after exhale, hold, try to contract your abdominal muscles and exhale a bit more air out for a count of 1 before starting to inhale. So the ratio will be 4:2:1 and 4:2:1. So that is a very important thing, because here we are adding inhalatory and exhalatory sniff, which is very important if you have any sputum or any collection in your lungs. So what we're going to do, simply, I'll demonstrate once. I'm going to inhale for 4. You're going to hold for 2. And before exhalation, for a count of 1, what I'm going to do, I'm going to take a bit more air in. And then exhale for 4. Now hold for 2. Before taking next inhalation, I'm going to contract my abdomen and exhale further. And then inhale. Hold for 2, and the cycle continues. Okay, so usually you do 6 cycles every technique. Okay, so now we are going to discuss about the uses of this effective breathing techniques in COVID-19 related lung complaints. This helps in clearing the lungs more completely by squeezing them and guide in expanding the lungs to its full capacity. See, if you have any collections of fluid in your lungs, you know, for example, a chronic smoker or elderly person who doesn't have a proper expansion of the chest, they all are prone to develop fluid collection in the lungs. You know, that is why when there are some fluid collection in the lungs, you become prone to develop these COVID-19 infections. So in those cases, the third technique that we saw, the inhalatory and exhalatory sniff, will force the collection to come in towards the upper respiratory tract, and then you can spit it out. Or the other important thing, if there are any starting stage narrowing or collapsing at the alveolar level, these techniques help to force open the alveoli and improve the ventilation. This is another thing, like if the alveoli are collapsing, you know, like sometimes the terminal bronchiole, it will be patent, but the alveoli behind will be collapsing because of some block by the collections of fluid. If it is getting blocked, the alveoli behind is going to be collapsing. So these techniques can force open, and the air can go beyond those collection and then push the collection out towards the upper respiratory tract, from where you can spit the sputum out. This could reverse the damages caused by the infection to a major extent and helps to prevent further complications. You can slowly increase the numbers as you progress within your comfort levels. Very important thing, you have to be very comfortable. See, a deep breathing exercise is not a big breath. You know, you shouldn't become gasping. Like, it doesn't mean you still have to be comfortable. Whatever number you choose, you have to stick to it. Don't keep changing, like don't keep altering in between. If you have chosen 4, then you stick to it until you progress to 5. It's quite natural to get cough at this stage, especially if you have any symptoms. Nothing to worry. It's good to add coughing here, as they can bring out the foreign particles, if any, or the sputum. So it's very common that if you have any collection of fluid, you will definitely start coughing by this time as you keep doing these breathing exercises. So here I would like to explain about the huffing and coughing technique. This is important. Again, if you have any collections while doing breathing exercises, if you feel like there is some sputum collection that is disturbing or obstructing, then you do this and clear your chest then and there. We're going to sit up straight with chin tilted slightly up and the mouth open. Take a slow, deep breath to fill lungs about 3/4 full. You're going to hold for 2 or 3 seconds. Exhale forcefully but slowly, contracting the abdominals in a continuous exhalation to move mucus from the smaller to the larger airways. Repeat this maneuver 2 more times and then follow with 1 strong cough. So I am going to explain that as well. The demonstration. This is important. If you have any, by the time, as I keep speaking and it automatically, I have some fluid collection coming here, It happens even if you have no other symptoms, so it doesn't mean that you have COVID-19, okay? So what you're going to do, if you feel like there is some blockage or some disturbance in the air passage, you're going to breathe in, not deep, like 3/4 of your lung capacity, Breathe in and hold there for 2 to 3 seconds, and then constrict your glottis, and then you're going to do like, So this brings all the secretions, if any, or the collection fluid towards the upper respiratory tract. Once it comes there, then you can cough like, and then you can spit it out. Please don't cough like that. Whenever you cough among people, you always have to cough under your armpit or have your mask ready. So these techniques can prevent you from your lung from getting any infection, but these techniques are not all. Like, there are other measures that you still have to continue. You have to continue your social distancing, like washing your hands or whatever it is. There are controversies, but it is still, these measures helps at least to impede the rate of spread of this dreaded virus. Coming to the technique number 3, yogic breathing technique. This is an advanced form of holistic and effective breathing technique, as it involves all the components that have designed these breathing techniques. This pattern of breathing has a very significant effect in gaseous exchange, as it draws air more to the lower lobes. As we saw, that is where there will be more blood available for gaseous exchange. So it draws air more to the lower lobes, where there will be more blood present, as we discussed earlier. This is very important in improving gaseous exchange and oxygen saturation, particularly during infections like COVID-19. People advise lying down prone on the tummy during, as we saw, So, but doing this yogic breathing technique, you can achieve the same effect even in sitting or lying on your back. This also prevents collapse of alveoli, which is one of the major complications of such lung infections. Just a moment. So I am trying to... Okay, so that is a technique. You're going to sit or lie down in a comfortable position. Start with abdominal breathing, expanding the lungs downwards, pushing the abdominal content down and outwards. Proceed to thoracic breathing, filling the middle lobes of the lungs that create an outward and upward movement of the rib cage. The process continues until slowly filling the upper chest. Once you feel that you have taken a complete breath, you can now hold for a moment and then start exhalation process in a reverse manner, starting from the upper chest first, and then the thoracic, and then the lower chest. In this manner, you ensure that you are completely breathing out. You can now hold for a moment before you take your next breath. You can number each component of breath like 4:4:4. That means 4 counts inhale, 4 counts hold, 4 counts exhale, and 4 counts hold after exhale. So that's going to be the demo of yogic breathing technique. Okay, it's important that you're going to use your abdominal breathing, your thoracic breathing, as well as your clavicular breathing. So what are you going to do? Of course, simply you can have your hands on the abdomen, or you can have hands on the chest, wherever you feel that you want to expand more. I'm going to simply have my hands on my abdomen, and I'm going to do 4:4:4. Just one cycle, please observe. What we're going to do, start inhaling. Now hold for 4. Now exhale. I'm sorry, I will demonstrate once again, because we have to use all the three components, right? I have to show you. I did, but I didn't explain. So what I'm going to do, inhale first with the abdomen. Start with the abdomen. Full, okay? Hold for 4. And then exhale starting from reverse. And hold for 4. And then the cycle continues. Now comes the significance of breath hold. The most important, of course, everything is important. Another important factor, the breath hold, has a lot of significant health benefits. I'm sorry. Interestingly, the goal of pranayama is kevala kumpaka. That's what I said. Like it's really amazing to notice how this ancient wisdom knows this scientific background, because the main goal of pranayama is to improve the kumbhaka, that is breath hold. It encourages deeper ventilation beyond the dead space. See, you are breathing in and out. The breath goes in and out, but as we saw before, your air goes in the dead space where there is no gaseous exchange happening. If only your breath reaches deep, and if only your breath stays deep for enough time, there can be more opportunity for the gaseous exchange to happen. So in that way, this breath hold helps in improved gaseous exchange that results in improved oxygen saturation. So biologically, it's during the hold time the gaseous exchange happens best. By increasing the hold time, we can promote the gaseous exchange. It also improves the neural control of breath by increasing the carbon dioxide level. See, it's very important that some people take big breath, that doesn't help, because that actually exhales too much of carbon dioxide. If the blood carbon dioxide level reduces beyond a certain level, it reduces the blood circulation to the brain, and it also breaks down the circuit of neural control of breath from the brain. It's also important that we have enough carbon dioxide in our blood. So the breath hold, few more significant points about the breath hold. Recent studies show increasing the lifespan by preserving the health of stem cells. That's about the breath hold. It actually increases our lifespan by preserving our stem cells. Studies also show that it increases the resistance to infection. Obviously, the deep breath gives more oxygen to the blood, and that gives more oxygen to our cells for a better cell respiration. It also results in possible regeneration of new tissue in the brain. So the deep breath and the breath hold are very important apart from preserving our lung. It is said that 20 to 60 seconds of breath hold is normal, subject to individual capacity. There was also another rumor going on, like if you can hold your breath longer, then it confirms that you don't have COVID-19. I'm sorry, there is nothing that can confirm that whether you have COVID-19 infection or not. Your breath hold, definitely the ability to hold your breath longer shows how healthy your breathing apparatus is. But it is definitely not an indication of whether you have COVID-19 infection or not. Okay, so definitely it's not a test against any infections, but definitely your breath hold will tell you whether your breathing apparatus is healthy or not. If your breathing apparatus is not healthy, then you can at least know that you belong to that high risk category where you should avoid social gathering. You should wear masks for sure. Of course, everyone should wear. At least you should protect yourself when you are going out in the public. So up to they say 20 to 60 is the common, even if it is 30 seconds, if you can hold the breath, it's still normal for some people, depending upon various conditions. As you age, the breath hold time reduces, but that can be normal for that particular aged person. So usually if you want to check your breath hold capacity ability, it's better you do that first thing in the morning. Like you get up, sit down, allow your breath to settle, and then see how long you can hold after exhale and inhale. Okay. Coming to the special pranayama technique, there are various special pranayama techniques which all are very beneficial for the whole body and mind. But I choose mainly, it should be three of them. Based on the research, these three techniques are found to have a direct effect on the lung infections like COVID-19. They are, as we saw, Nadi Shodhana Pranayama, Brahmari Pranayama, and Ujjayi Pranayama. Coming to the Nadi Shodhana Pranayama, as I think most people will know, alternate nostril breathing. This is the first pranayama described in the classical yoga text, like Hatha Yoga Pratipika. The word Nadi means energy channel and Shodhana means to cleanse. Therefore, by definition, Nadi Shodhana is a practice of cleansing or purifying the pranic energy channels as per the yogic anatomy. There are many other benefits attributed to the practice of this pranayama. There are several research results that show how this Nadi Shodhana pranayama can bring about a balance between the sympathetic and the parasympathetic nervous system, which will in turn bring balance and harmony in every bodily system. We will be discussing in detail about the scientific background of this Nadi Shodhana pranayama tomorrow, because it has more benefits in our psychological well-being as well. Coming to the technique, you're going to sit in a comfortable position. The next point is very important. Keep the head and spine upright. It's very important whenever you do your pranayama techniques. You have to keep your spine and head upright. Start with practicing yogic breathing. So always before doing any pranayama, do a couple yogic breathing techniques before going to the actual pranayama technique. Adopt Nasikagra Mudra with the right hand and place the right thumb over the right nostril and right ring finger over the left nostril. These two fingers help in closing nostrils alternatively. Basically, fingers exert mild pressure on the nostrils. So both nostrils are always remaining partially closed. You can either place the index and middle fingers between the eyebrows, close the right nostril completely with the thumb, and slowly breathe in through the left nostril. Hold for a count of 4. So I'm going to demonstrate this now. Okay. So let's go demonstrate that. Okay. Nasikagra Mudra is like that. You're going to fold your index and middle finger and leave your ring finger and the thumbs free. Okay. So your thumb goes on your right nostril and your ring finger sits on the left nostril. Throughout the pranayama, you will be constricting both the nostrils. Both the nostrils are not let free. They will be partially closed on both sides. We are going to do alternate breathing, or we are going to close completely alternately, but even the other one which is open is going to be partially closed. The purpose is, it's so beautiful that the yogis have done this ways like from ancient times. But the purpose is that actually causes the necessary vibration in the paranasal sinuses in order to produce the nitric oxide, which will in turn help us to improve the production of surfactant. So beautiful science behind this ancient breathing technique. So what we're going to do, we're going to hold like that. So you're going to close your right nostril and breathe in through your left nostril. 4, you're going to hold that. Now you're going to close your left nostril and open your right nostril, and you're going to breathe out through left nostril. Hold. And now we are going to breathe in through right nostril. Hold. And now close your right nostril, open your left nostril, and breathe out through your left nostril. That completes one cycle. So breathe in through your left, hold, breathe out through your right, hold, breathe in through your right, hold, breathe out through your left. That's one cycle. You can do that for 6 cycles. That is the Nadi Shodhana Pranayama. The important benefit of this Nadi Shodhana Pranayama is it has a direct effect on the autonomic nervous system, which has sympathetic and parasympathetic nervous system. Of course, we'll be seeing in detail how this can influence by improving the vagal tone. You know, the vagus nerve is a very important parasympathetic nerve present in our body, which actually connects our abdomen with the chest and the brain. So in that way, we can influence all the systems. You know, these are all beautiful scientific facts that we find behind doing these ancient yogic techniques. Coming to the technique number 5, which is very important, Bhramari Pranayama, humming bee breath. This is one of the most important technique of pranayama, which has almost all the qualities needed to fight against the lung complications due to coronavirus infection. The word Bhramar means bee. This practice is so called because the practitioner imitates the same deep, low-pitched humming sound as that of a black bee. It is also important to practice this technique with Shanmughi Mudra, which is known as closing the 7 gates. I'll be showing that shortly. So the humming and the closure of the nose cause the vibration in the nasal cells that promotes release of nitric oxide from paranasal sinuses into the nasal cavity. Same thing, same factor. The nitric oxide released at the nasal cavity is found to act as a front-line defense against infections. Yes, it has an antimicrobial or antiviral effect that sterilizes the air that enters the lungs. Also, this nitric oxide plays a vital role in the production of the surfactant at alveoli. As we saw earlier, this helps to prevent collapse of the lungs. You know, the other important aspect here is the nitric oxide also redistributes the blood circulation to the lungs. That's another important factor that is missing here. Especially the sound, causes the right vibration in the nasal cells. So chanting Om along with pranayama also has similar effect. If you have any concern doing that, you can simply do, that is the vibration we need to stimulate the paranasal sinuses. That's a technique. You're going to sit in a comfortable position. You're going to hold your neck and back straight. That's more important whenever you do your pranayama breathing. Close the eyes, close the ears with the thumbs. With the thumbs, I'm going to close I will demonstrate that. So bring the awareness to the center of your forehead where the Ajna chakra is located, and keep the body absolutely still. Inhale through the nose. See that it's open partially by the help of the middle fingers. Hold the breath if you want, while exhaling slowly in a controlled manner. Produce a deep, steady humming sound like that of a black bee. Be aware of the continuous humming sound within the head. The humming should be smooth and even for the entire duration of the exhalation. With that, we are going to demonstrate that. That's the most important pranayama technique in the fight against COVID-19 related lung infections. So what I'm going to do, I'm going to close my ears with my tongue, and I'm going to use all my fingers. So I'm going to use one finger closing my eyes, the middle finger closing my nose, and the last 2 finger, ring and little finger, sitting on top of above and below my mouth. So it closes all, like closing all the gates, So, but for the demonstration purpose, I'm going to use only my thumb and the middle finger to close my ears and the nose. Okay. So I'm going to close like that. Okay. What are you going to do? You're going to breathe in through your nose. if you want, see, while breathing in, your hands, your fingers partially close your nostrils. Okay, so you're going to breathe in. You can hold if you want for 4 counts, and then as you exhale, you have to concentrate. You have to bring your concentration to the Ajna chakra, that is in between your eyebrows. You know, as you exhale, you're going to create that humming sound, and you will be able to feel that it vibrates throughout your skull. You know, so you're going to do like that. I'm inhaling. Hold. And as I exhale, hope you're able to hear, but it is not necessary that it should be so audible outside. It's mainly for you, the practitioner, to feel that vibration and the humming sound within yourself. Okay. Coming to the last breathing technique, Ujjayi breathing. So Ujjayi means victorious. This has a direct effect on the autonomic nervous system. It's calming, relaxing, and tranquilizing. Importantly, it clears the throat from the congestion due to accumulation of phlegm. You have to remember in this place, I would like to remind you, the main focus of this COVID-19 infection is our throat. That is where the infection spreads further down to our lungs. So if you can prevent the infection at your throat level, that's why always, please remember, whenever you are out, going back home, please goggle and do all those stuff. You know, it's not just doing pranayama alone, but you have to follow all those other our traditional stuff that do, particularly with salt water goggling, you know. Of course, there are like lozenges and gargling artificial stuff, but it's better always to use a salt in a warm water goggling, you know. So this can be done in any position. The tranquilizing effect helps in treating conditions like insomnia, done by contracting the glottis and breathing through the throat. Sounds like a baby snoring. If you watch and listen to a sleeping baby, it snores, you know. Same kind of sound we are going to make, but that sound, it need not be audible outside. It is for you to hear, okay? And you're going to contract the glottis. So you're going to sit in a comfortable position, take a couple yogic breathing, have the awareness in the throat, feel like the breath is being drawn in and out through the throat and not through the nostrils, as if it's taking place through a small hole in the throat. Gently contract the glottis so that a soft snoring sound is produced. The sound should be audible only to the practitioner. Both inhalation and exhalation should be long, deep, and controlled. You can add hold as well. So the main thing. So let me demonstrate. Okay. Simple. You're going to breathe in. Let us start doing it in exhalation first. Okay. I'm going to breathe in. As I breathe out, I'm going to constrict my glottis, and then the air, I will feel the air as if coming through a tube, constricted tube, you know. I'm doing it a bit more audible for you. I don't know whether it's audible. Breathe in and then breathe out. And then breathe in again. If you want, you can hold after inhalation as well as after exhalation. So this actually clears the chest. Clears the throat and masters the chest as per the traditional yogic scriptures. So this technique clears If there are any infections in the starting stage at your throat level, that's going to clear the infection right away. So this is another amazing technique found by our ancient yogis. Yeah, that is about our info. Our website, www.fitcampphysio.com. We are organizing regular online classes for yoga and pranayama, especially totally free of cost for now. I think we will continue to do. We decided to do until August, but I think seeing the pandemic situation, we probably will continue beyond that too. So you can learn other yoga techniques as well along with these pranayama techniques. It will be totally guided, an hour-long session. So please enroll if you'd like, or you are also can learn all these techniques from a qualified yoga therapist, so that you can use. See, this model that we have done, these techniques, we wanted everyone to do, whether you are a normal person without any symptoms who wants to prevent any infection, or whether if you are a COVID-19 survivor with mild symptoms, mild to moderate symptoms, or whether you have severe symptoms and someone in an ICU, like they also can practice all these simple yoga techniques, which will prove really effective and useful in the prevention and management of COVID-19 related lung symptoms. Other important information about breath hold, two additional benefits of breath hold. One, I'm sorry? There's something for me?
No.
So if you're wearing a mask, like it's really difficult when you're wearing mask and working continuously, you are breathing your own carbon dioxide again and again. That's going to make you exhaust sooner and feel tired. So practice this breath hold after exhalation when you are under mask. After exhalation, hold your breath for a couple seconds. Allow the air to disperse out and then take the fresh breath in through the mask, filtered air. That is one important additional benefit with breath hold technique during the situation. Another one is, if you are among people in a public and if someone coughs or sneezes, hold your breath and run away as far as possible, because like this viral infection, it's not airborne, but it remains in the air up to 10 feet distance, and it settles down on the floor after that. So if you are within that periphery of the infection to reach, you can definitely catch it. So breath hold if you are among unknown people who are sneezing or coughing, and get out of that place so that you can escape from getting infection. Other thing with breath hold, also if you are among an infected person, if it is a near and dear of yourself, practice breath hold as much as possible so that you are not catching any infection there. And practices Ujjayi breath to clear your throat every time, like often, so that you can clear. If there are any infection, you can clear. And practice huffing and coughing techniques so that you can clear your lung fields as well from these collection of fluids. I think with that we are done, and I'm really thankful to all the eminent professors for giving me this opportunity, and thank you so much for one and all who joined me in this session of webinar today. Hope to see you all tomorrow. Tomorrow it's going to be a bit more longer and a bit more important topics to discuss. So I think we can open the session for questions. So are any of our professors going to read out the questions?
Yes, thank you, Dr. Senthil Kumara Raja, for a very interesting presentation. And now we have a question and answer session. There are questions coming up in the chat box. And the first question is, for diabetic patients, is there any exercises?
It's total out of context question. There are a lot that we can do for diabetes. Unfortunately, I'm sorry, it's totally out of context. Like it's better I cannot start another new topic now. I advise sincerely to visit some yoga therapists and learn proper exercises, or you can join in our session. Maybe in those sessions we'll be able to help you out.
Yes, similar type only. We have questions for thyroid problem and pressure. And Milton, is there any questions from YouTube?
Nothing specific to the topic, man. Similar questions, thyroid and diabetes.
There are. See, when we say yoga can help in several conditions. It's not just respiratory system. It can help in the balancing hormones. It can help in normalizing your blood pressure. It can help in reducing your heart complications if you have any heart symptoms. It can help in stress and strain. Like most of the time, that's what we are going to discuss in our tomorrow's topic. We will be discussing a lot about how what techniques that we are going to do and how they are going to help in effectively managing stress related. Most of our all the diseases, like whatever you say, the modern lifestyle diseases, high blood pressure, diabetes, thyroid problem, kidney problem, all those problems, they are some way connected to our psyche. So even though there are different techniques and different approaches for given condition and problem, we will stick on to the topic. You are welcome to consult a yoga therapist, or welcome to join our free online yoga sessions where we will definitely be able to answer all your questions.
Okay. And there is a question for 50 plus age. Any specific precaution to be taken in pranayama?
See, if you have high blood pressure, definitely you should not hold your breath longer. There are certain contraindications, like if you have like a bronchopulmonary fistula or any bronchial complications, if you have any injuries around your chest, if there are any fractures of your lungs, all these stuff you have to avoid. So that is why for 50 plus, we always advise, if you have associated blood pressure, high blood pressure or diabetes, before starting any exercise program for that matter, please consult your physician or doctor before starting. If you have no problem, no associated diseases, then you are welcome to start doing it, provided you are not holding your breath longer. You can gradually progress. Don't think that you have to quick start with 8 is to 8 is to 8. No. Start with a lower number and progress slowly. See, one important concept of yoga is acceptance of what you have. Don't compare yourself with your fellow person who is doing better than you. So it has to be yoga has to be individualized, not like a random one that everyone can do. So I would advise you to go see a doctor if you have any associated problem and if you are 50 plus.
And there is a question, how does pranayama directly helps in wheezing problems, sir?
Yeah, like people with asthma, they are high risk group for this COVID-19, So these first thing, what happens with your asthma wheezing problem? Your bronchus constricts. Your bronchus constricts, when you have a fast breath, with asthma, there is like that when your breath goes in and out of your bronchus fast, because of the friction, the bronchus is going to constrict further. That's where slow and deep breath will reduce that bronchial friction, and that will reduce the bronchospasm. And particularly Ujjayi breathing helps in actually releasing the tension in the lungs. And the other thing is it also, the yoga pranayama also influences the vagus nerve, which will in turn relax the bronchial tree, so that as you breathe, you feel lesser and lesser tension with wheezing. And definitely doing pranayama during an attack of asthma helps you to quieten, calm down, and relax.
Yes, there is a question from our Professor Ilongo sir. Can a person who has undergone multiple abdominal surgeries can do pranayama?
Fantastic question. Yeah, like, see, definitely if you are under your guidance with your doctors, you definitely can discuss with your doctor before starting. And with the abdominal exercises, your abdominal muscles will be poor. We don't know whether there are any insertions that gone into your diaphragm. Your diaphragm is entirely, see, we name it abdominal exercise, breathing exercise, but as per yoga, abdomen has got nothing to do with your breathing. It is your diaphragm about which we are interested. You know, you have to breathe and train your diaphragm better so that your abdominal tone also will improve. So definitely you can start doing with low numbers, but I will still advise you to get an opinion from your doctor before starting. But definitely you can do. Yeah.
Yeah. Then there is a question about remedy about panic attack. I think tomorrow this will be covered under anxiety. Okay, so the next one is there any time limit of yoga in a day?
Time wise. Okay. So time wise, usually we say like 40 to 15 minutes. There is no rule at all. Yoga is something that you have to, the first thing is you have to do, it's better to do on an empty stomach. If you are diabetic and if you're prone to develop like hypoglycemia and other stuff, it's not advisable to do in an empty stomach, but lighter meal, you know, or light snacking before doing any exercise will help. But generally on an empty stomach, half an hour to an hour is good to do yogic exercises. Usually we start with simple yoga postures, and then we lead to the next stage of pranayama, and then pratyahara, and then meditation. We progress like that and stop at meditation.
Yeah. And there is a question, you told about mudras. One is chin and the other you said you will show in demo. Can you do and show?
I show both mudras. One is the Nasikagra mudra and the other one is closing the 5 gates. Oh, I'm sorry. It's not, this session is not anything related to do with mudras. It is actually the mudras used for doing that particular pranayama. Probably that's a confusion. So I haven't included mudras here. Of course, that's another science. You know, there are several subsystems in yoga therapy that you can use in the treatment and management of several bodily issues, psychological, physiological, and mental issues. But the mudras that I told, those are mudras that we use for doing that particular pranayama, and not for specific any mudras. That is another separate topic. I'm sorry.
Okay. And will pranayama help for allergy problems?
Skin problem. Yeah, see, that's another. That is another separate topic. I think we will stick on to the topic. Like, of course, it can help. You can consult a yoga therapist. There are separate techniques for that too. One moment, please. Please, Doctor. I just have to answer one question I've seen. Of course, yoga has got nothing to do with any religion. That's one explanation I wanted to give. As you mentioned, like how electricity and all our modern sophisticated structures stuff are invented by people belong to several religions, particularly Christianity. They cannot claim they all belong to Christianity. Same way yoga is a pure science. It doesn't belong to any religion. One thing. Second thing, people are asking about the link to enroll in our this thing. So it is given in our website. If anyone is interested to join our online free yoga sessions, you can enroll so that we can take you in the earliest available slot.